Hi there! This is part of an informational series made for anyone considering breast reconstruction surgery. The aim of this short video is to give an overview of the operation known as the DIEP Flap reconstruction. We hope that this will help answer any questions and hopefully reduce anxieties that you may have related to the procedure. We also hope that the video helps you to be able to discuss the DIEP Flap option with friends and family, and ultimately helps you make an informed decision regarding whether the DIEP Flap is the appropriate type of breast reconstruction for you. This video consists of 5 sections. What is a DIEP? Preparing for the operation, during and after the operation, potential complications, and the pros and cons of DIEP versus implant. After watching, you may have further questions specific to you which may not have been addressed in the video. Please jot these down and feel free to discuss them with your surgeon or specialist nurse. What is a DIEP? The DIEP flap involves reconstructing the removed breast or breasts using excess skin and fat removed from the tummy. An eye-shaped cut is made on the lower tummy to get the skin and fat to make the new breast. A round cut is also made around the belly button to allow the belly button to be left behind on the tummy. To keep the tummy skin and fat alive, the tiny blood vessels which supply blood to the skin and fat are also taken with the flap. This skin and fat, together with its blood vessels, is called the DIEP flap. The DIEP flap is then moved across to the area of mastectomy to make the new breast. Then, to keep the DIEP flap alive, the blood vessels in the flap are stitched to blood vessels under a rib near the breastbone or to blood vessels in the armpit to supply the blood to the flap. These blood vessels are so tiny that the plastic surgeons have to use a microscope to stitch them together. The DIEP flap is then shaped and stitched into place to make the new breast. The remaining tummy is pulled down and stitched close, like when having a tummy tuck. A small hole is made in the tummy skin so that the belly button can be brought back out and stitched into place. After the operation, once healed, there will remain a hip-to-hip scar and a circular scar around the belly button. The hip-to-hip scar is long but can easily be covered by underwear or bikini bottom. The DIEP flap can be used to reconstruct one or both breasts. Not infrequently, if only one breast needs to be reconstructed, the other breast may need an additional operation to match it up to the size and shape of the newly reconstructed breast. Preparing for the operation. Some days before the operation, you'll be asked to come into hospital for a CT scan to map all blood vessels supplying the DIEP flap. This helps your surgeon ensure a high chance of success for the operation. To reduce the risk of infection, you'll be given an antiseptic wash to use for 3 days prior to the operation. It is also recommended to have high energy drinks for a few days before your operation to build up your carbohydrate reserves. Our team will ensure that your home circumstances are ready for when you are discharged. You'll also be given advice about physiotherapy and exercises after the operation. On the day of the operation, you'll be seen by your plastic surgeon, who will rediscuss the operation with you and address any questions or concerns you may have. They will discuss possible complications of the procedure and obtain your written consent to perform the DIEP flap to reconstruct your breast. Your plastic surgeon will also draw some planning lines on your tummy to prepare for the operation. If you are having your mastectomy on the same day as your reconstruction, a second surgeon, the breast surgeon, will also see you to discuss the mastectomy operation. As well as the surgeons and the friendly nursing staff who will be looking after you, you will also be seen by the anaesthetist. The anaesthetist is a doctor who puts you off to sleep for your operation and ensures that you stay safe and well, both during the procedure and once you wake up after. The anaesthetist will discuss all aspects of the anaesthetic and address any questions or concerns you may have about it. During and after the operation. The reconstruction usually lasts between 6 and 9 hours. After the operation is finished, you'll be woken in the theatre, spend some time in the recovery suite, and then be transferred to the plastic surgery ward. On the ward, you should be looked after in a warm side room for 2 to 3 days before being discharged home. You'll be given fluids by an IV line and have a tube in the bladder known as a catheter, so that the nurses can monitor if you're producing enough urine and to minimise getting up to use the toilet. You will have careful, regular and frequent monitoring by highly skilled nursing staff during your stay, and if they have any concern, they will contact the surgeons. The flap should look the same colour as your normal tummy skin, not too blue or pale. It is important that you are comfortable, pain-free, warm and well hydrated to ensure that all is well with you and your flap. By day 1, our nurses and physiotherapists will help you to be out of bed, sitting up in some comfy pyjamas, with your catheter removed and eating and drinking as normal. By day 2 or 3, you'll be able to have a shower and start some exercises under the guidance of physiotherapists, and possibly be discharged home with the right support. People are independent at the time of discharge but will need to be looked after by an adult for around 2 weeks. By week 3, all wounds are usually healed. It'll be around 6 weeks before you can resume normal activities depending on preoperative fitness. Everyone is different and this may not be the same for you. The surgery itself is not painful, but the tummy area can feel tight and uncomfortable during this time. It can sometimes take up to 3 months for the tummy to feel normal again. The DIEP flap is a very complex operation and takes several hours to perform. However, not to worry, an entire team of people are devoted to looking after you before, during and after the operation to ensure that the DIEP flap is successful and that you are well and comfortable during this journey. However, on occasion things may not go as planned and complications can occur. Minor complications are uncommon and major complications are rare. Complications that can occur include: risk of flap failure is 2.5%. The operation may cause weakness of the tummy wall, bleeding. The risk of this is very low. Less than 1% require a transfusion. Other more serious risks include clots in the legs or lung, heart attack or chest infections. Most complications are related to the wound healing in the early post-operative period that can be easily managed with dressings. The positives and negatives of DIEP versus implant. Positives. As the DIEP flap is made of urine tissue, there's no implant to worry about. It'll look and feel natural, move like a normal breast, and it'll feel more like yourself. As you age, and if you gain or lose weight, your reconstructed breast will change along with you and your other breasts. A lot of people appreciate the freebie mini tummy tuck as well. Negatives. From a technical standpoint, the operation is more challenging and long. Along with it comes a higher risk of complications. The scars left behind from the surgery will be longer than scars left by the implant surgery. Recovery time after the operation is also longer. This operation won't be suitable for everyone and your doctor will advise you if this is the case. You are an individual. What's right for someone else may not be best for you. Hopefully, this video has shed some light on the procedure behind the DIEP operation and will help you make a confident and informed decision that feels right for you.